Your doctor has told you that you have a torn anterior cruciate ligament in your knee and has recommended arthroscopic surgery in order to repair it. But what does that actually mean? The knee is one of the most complex and one of the most important joints in your body. It is made up of bone, ligament, and cartilage. Damage to any individual part can dramatically restrict the normal movement of the leg and can even interfere with the ability to walk. Let's take a look at the way the knee joint is put together. The femur, or thigh bone, meets the fibula and tibia to create a flexible joint called the knee. Helping to stabilize the knee are the ligaments. The ligaments in the knee are strong, flexible cords of tissue that hold the bones together. They maintain stability and allow the normal range of motion when you walk or run. The anterior cruciate ligament, or ACL, guides the tibia, or shin bone. It helps keep your feet below your knees and your legs from buckling as you walk. Twisting or bending the knee during sports or other strenuous activities can damage the ligament. During an injury, patients often report feeling or even hearing a sudden pop in their knee at the exact moment when the ligament tears. Other symptoms include swelling, restricted movement, pain, and even the inability to stand on the affected leg. To perform arthroscopic surgery, your doctor will make a few small buttonhole-sized incisions in the area around the knee. An arthroscope is a very small video camera that your doctor uses to see the inside of your knee and to guide the surgery. Before your doctor can insert the arthroscope, the surgical team must inject a clear fluid into the joint. This fluid will inflate the interior space and will help your doctor by providing an unobstructed view and enough room in which to work. The actual surgical instruments will be inserted through one or more other small openings. After verifying that the anterior cruciate ligament, or ACL, has been severed, your doctor will begin the procedure by removing a piece of tissue from the front of the knee. This tissue, or graft, has bone on both ends and a section of tendon stretched between. Next, the team drills a hole in the end of the thigh bone and another in the top of the shin. These holes become the sockets for the bony ends of the tendon graft taken at the beginning of the procedure. The ligament graft is then inserted into place. When the procedure is complete, the team withdraws the instruments and the surgical fluid drains safely from the knee. Following surgery, sterile dressings are applied. To aid in healing, your knee may be stabilized with a brace, and you'll be encouraged to use crutches during the recovery process.
The supplies you will need to have easily accessible in the bathroom include clean clothing, skid-proof plastic bath mat, 2 washcloths, 2 towels, soap, shampoo, plastic pitcher, skin lotion, comb and brush, disposable gloves, and a sealable plastic storage bag. Ensure that the bathroom is pleasantly warm, around 70 degrees. Place the skid-proof plastic bath mat in the tub and fill 1/3 of the tub with warm water. Test the temperature of the water with your hand. Wash and carefully dry your hands. Put on your disposable gloves. Help your patient undress and place soiled clothing in the plastic bag in the laundry hamper. Help your patient sit on the edge of the tub. If there's a grab bar on the back wall of the tub, have the patient hold it with one hand. Swivel and lift both legs into the tub. From the back, support your patient under both arms and help him slowly lower his body into the water. Encourage your patient's independence and have him do as much of the washing as possible. You may need to assist in such areas as the patient's back and to rinse off all soap with a shower extension or a pitcher. If it's shampoo time and the patient cannot do it himself, you can have him hold a dry, folded washcloth over his eyes to protect them. Pour clean, warm water over the patient's head using a pitcher or shower extension. Rub in shampoo and massage the patient's head. Rinse off the shampoo with clean, warm water using a pitcher or a shower extension. Dry the hair. If possible, have the patient stand and help him dry his upper body. Otherwise, dry his upper body and arms with him sitting in the tub. Let the water out of the tub. With a towel over his upper body, help the patient sit on the edge of the tub. Support the patient and help him swivel his legs over the edge of the tub. He can rest for a while if need be. Help dry the rest of the body, paying attention to under the arms, other skin creases, and in between the toes. Apply body lotion to the skin and help the patient dress. After making your patient comfortable, return to the bathroom. Place soiled towels and washcloths in the laundry bag. Clean the tub and mop the floor. Remove your gloves, discard them into the plastic storage bag. Seal the bag and place it in the trash. Carefully wash and dry your hands. The equipment you will need to assemble includes 2 pairs of clean disposable gloves, cleansing solution, small gauze pads for cleaning, large gauze pads for dressing the wound, adhesive tape, a large sealable plastic bag. Carefully wash and dry your hands. Put on your gloves. The first step is to remove the old dressing. Loosen the edges of the tape and peel the tapes off the skin by pulling them towards the wound, keeping the skin taut with the other hand. Lift the tapes and the dressing off together. Note any odor or color of any drainage on the dressing. Discard the dressing and tapes into the plastic bag. If the dressing sticks to the wound, pour a little cleansing solution onto the dressing and let it sit for a minute. Gently pull the dressing off, keeping the skin taut above the wound. Look carefully at the wound. Any of the following should be reported immediately to your doctor or nurse: redness of the wound or surrounding skin, drainage from the wound, particularly if it's yellow and smells, any bleeding, swelling of the skin around the wound, separation of the edges of the sutured wound, or maceration, a waterlogged appearance of the edges of the wound. Pour some cleansing solution onto a small gauze pad. Squeeze out the surplus solution and with one stroke, clean the wound from top to bottom. Discard the gauze pad into the plastic bag. Using a fresh gauze pad with cleansing solution for each stroke, work away from the wound to clean the skin for about 3 inches from the wound on either side. Stroke from top to bottom and discard each gauze pad into the plastic bag. Remove your gloves and discard them into the plastic bag. Wash and dry your hands. Open the package with the large gauze dressing. Put on clean gloves. Pick up the gauze dressing, holding it only at 2 diagonally opposite corners. Center the gauze pad over the wound and place it on the wound. Tape the dressing securely in place. Remove your gloves and discard them into the plastic bag. Seal the bag securely and discard it into the trash. Wash and dry your hands. If your skin is sensitive to the adhesive on the tape, hypoallergenic tape can be bought at your surgical supply store, or bandages or binders can be used to hold the dressing in place. Consult with your doctor or nurse.